Good evening, everyone. First of all, welcome back. And I want to introduce Dr. Janice Fitzgerald, who will give us the update. Of course, she's the Chief Medical Officer of Newfoundland and Labrador, and she'll give us the update on the overnight of COVID-19.
Thank you, Premier. Good afternoon, everyone. Today, I'd like to advise that we have 15 new cases of positive cases of COVID-19 in Newfoundland and Labrador. These cases are all in the Eastern Health region. We are now able to confirm positive cases at our Provincial Public Health Laboratory, and Public Health is initiating contact tracing for all of these cases, and those who are close contacts will be advised to quarantine. Our total number of cases is now 82. Of these, everyone is recovering at home. This means we now have 76 cases in Eastern Health Region, 2 in Central Health Region, 1 in Western Health Region, and 3 in Labrador-Grenville Health Region. Our cases range from ages 8 to 80. The median age is 55 years. Of these cases, we have 7 people under the age of 19, 9 between 20 and 39, 12 between 40 and 49, 21 between 50 and 59, 15 between 60 and 69, and 18 above 70. We have tested 1,491 people, and of those, 1,409 have been confirmed negative. We have swiftly been using the public health measures at our disposal to help minimize the impact this virus has on our province. Another lever we have in our province is to pull on is our strong sense of community. We are accustomed to helping our neighbours and those in need, and we answer the call. But now support for your family, friends, and neighbours takes on a different meaning. Support now means staying home, unless it is essential to go out. By staying home, you are helping to protect those that still have to go to work to ensure we continue to have our essential services. You are staying home so that we can minimize the risk to our healthcare workers, our grocery store workers, our municipal infrastructure workers, and others. If we are not out mingling, we can delay the virus's spread. Flattening the curve is all of our responsibility. I want to speak for a moment about those accessing healthcare services. When accessing healthcare, let your healthcare provider know whether you are at increased risk for COVID-19. This will allow our healthcare workers to put on the appropriate personal protective equipment and protect themselves. This is for everyone's health and safety. Your access to healthcare will not change. You will still get care. If you are sick and do not require medical attention, you must stay home. If you are healthy, go out only for essentials. Wash your hands frequently and well, and practice physical distancing. In summary, we have 15 new positive cases in this province. Our total number of cases is now 82. How we act now affects how this will unfold in our province. This is a new reality, and it won't be over by Easter. We must have patience. We must be diligent. We are in this together. Thank you.
Thank you, Dr. Fitzgerald, and good afternoon, everyone. Today, which is an historic day in Newfoundland and Labrador, we have opened up our legislature in what is an urgent sitting of the House of Assembly. And it was critical issues that are being dealt with in this unprecedented time in our province. It has never been more important for all of us, as Dr. Fitzgerald has just said, for all of us to work together, but even as legislatures to advance significant legislation. Collaboration is at the forefront. Politics is put aside. So I want to thank our joint committee members, Mr. Jess Crosby and, of course, Alison Coffin and myself, who working with health officials whom we meet with every day. Of course, Minister Haggie joins us on those meetings, as well as other ministers when required. And what we're dealing with are measures that are associated with how we respond to the measures associated with reducing the spread and protecting you as a result of COVID-19. Today's opening of the House of Assembly is once again putting supports in place, both socially and economically, that will impact our province. the legislative amendments that we are discussing this afternoon complements the initiatives that we have already actioned. Amendments that will support residents, support families, and support businesses. But they will also provide support for employee protections. We do not want to see anyone lose a job as a result of decisions that they have to make related to COVID-19. We are also looking at protection for tenants of rental properties. This is so tenants don't face eviction if they encounter lost income and not able to pay the rent as a result of COVID-19. We're extending interim supply, which means putting in place financial measures to September the 30th, so the money is available to pay for the services, just in case we find ourselves in disruption of the legislature between now and June of 2020. This ensures that existing government services, such as health care, can continue. Today, we are also introducing some $200 million in contingency funding. This is to address the impacts of COVID-19 related to reduced oil prices. We're looking to provide long-term care borrowing authority for some $2 billion. Now, normally this is a part of the budget process within our province, but we're seeking the authority as your government to continue to borrow through the remainder of this year. This will allow, once again, the ongoing government operations, as well as the ability to respond to the current revenue volatility in our province. We are looking to put in place temporary variation of deadlines when an activity needs to be done. This could be something as simply as an annual report or audit reviews. Now, we're not looking for this to be endless without an expiry date. This will be a 6-month extension till the next sitting of your legislature. Also today, on the floor of the House of Assembly, we will be discussing the borrowing capacity of Hydro Corporation, of course, and this is some additional borrowing capacity to support Hydro just in case we see revenue reduction as a result of COVID-19. I want to provide some further information about the amendments to the Labor Standards Act, as this will provide measures for leave of absence without pay. This is about job protection if an employee is unable to work for the following reasons. If the employee has returned from travel and must self-isolate, if they are under urgent or under medical investigation supervision for the treatment of COVID-19, if they're in isolation or quarantine due to COVID-19, if the employee is acting in accordance with the public health direction, if an employer directs the employee not to work due to COVID-19. Also, if the employee needs to provide care to a person for a reason related to COVID-19, such as school or even daycare closures. But if the employee is directly affected by travel restrictions and cannot reasonably be expected to travel back to the province. This is what today's amendments under the Labor Standards Act is all about. So they make it quite clear that the employee will not be required to provide medical note for this leave as well. This legislation is about putting supports in place for residents of our province as we navigate our way through COVID-19 together. This is to help prevent the spread of COVID-19 virus during this pandemic. We have also put in place new restrictions around our provincial ferry crossings. These restrictions are limiting passengers to essential workers who are traveling to their workplace, about patients traveling for medical reasons, including such things as a doctor appointment or for a pharmacy for medications. Also for those traveling to purchase essential goods and supplies, could be groceries that are not available in your home community. For those supporting and transporting essential goods. Also today we're talking about the limit of the interactions between passengers and crew members on our provincial ferries. This will allow time to clean the vessels. The number of trips for each ferry run is being reduced, so we can allow for some cleaning by the staff. Passengers can also remain in their vehicles during crossings to practice social distancing. However, with the discretion of the captain from time to time, people or passengers may be able to vacate their vehicles. Today, I also want speak about the travelers between Cornerbrook and Blanc-Sablon on the Comedic W. The number of passengers traveling on that route has been reduced to 53. For passengers who are currently returned from travel outside the province, you must inform the ferry service provider as soon as possible. I also want to give clear direction in regards to businesses with existing contracts with the provincial government. Those contracts will be honored through the duration of the COVID-19 pandemic. The businesses and the contractors who have existing contracts with government are required to continue to pay their employees who were put in place prior to the issuing of the public health state of emergency. Please, this is not an opportunity for you to make more money while we continue to pay those contractors. The least that you can do is pay your employees. That is the direction today. As an example, if you have a bus contractor, we're asking you to retain the drivers that you have on your payroll during the time of the suspension of your service. Now, yesterday, Prime Minister Trudeau announced that people returning from outside of the country in the 4 airports that are identified as international airports. If you're returning from an international destination into Vancouver, Calgary, to Toronto, or in Montreal, these are the 4 designated international airports, you must immediately self-isolate for 14 days. But I want to explain this a little bit. If you come into an international airport and you have to continue to your final destination, like Newfoundland and Labrador as an example. If you're asymptomatic, you can continue to travel. If you're symptomatic, you must self-isolate. There will be random checks throughout your 14-day self-isolation. If you're self-isolation as you continue to travel, once you reach your home in Newfoundland and Labrador, you must self-isolate at your final destination here in Newfoundland and Labrador. So to break it down further, this self-isolation period is for 14 days. This is not new if you travel from another province in Canada or from an international destination. Now, just yesterday, we've heard about challenges from truck drivers traveling across the province that have been restricted from having access to things like washroom facilities. So I want to let you know that we've been in touch with the companies and that we have been ensured that your access to washroom facilities will continue. They will not be restricted. These long-haul truck drivers are carrying essential products like food and medical supplies to our province, and it's important that they have access to these facilities. I also want to talk about Canada Post today, and I know many of you are aware of the disruption that's associated with the temporary closure of the St. John's mail processing plant and the delivery depot here in Canada Post. So today we want to mention about about the delivery of checks by the province. So what we've been able to do is establish from St. John's to get for income support people that we have made provision with Canada Post in areas, in their depots, in their areas, their post offices outside of St. John's for the checks to be delivered there. It's important to note that 96% of our income support receive their checks by electronic support, but there are others. We could have landlords who receive checks from your provincial government, some pensioners, support enforcement as an example. So we're now making provisions. The checks are being cut as we speak, and we will make provisions to get those checks in your hands. So it's important that this information and these announcements that with changes in legislation, how we get money into the hands of our income support recipients and others that I've just mentioned, that all these guidelines that we will continue to enforce with the state of emergency that we have put in place a few days ago. So this is about protecting you and is about supporting you. Now, we have talked at great length at this table about bringing law enforcement and taking away your license as an example if you are not being compliant with guidelines. So once again, we will remind everyone and reiterate that not standing by the guidelines that we put in place, these are reckless practices, these are reckless behavior. So let's be responsible. This is not where our focus should be right now, but we will be prepared, as Dr. Haggie has said many times, to take action if it's needed. I also want to say that the majority of you're at home, you're safe, and you're doing the right things. So I want to compliment you on doing what is the appropriate thing, protecting you and your family. You are setting a good example of what it takes to be leaders in your community and leaders in your home. So your actions today, as Dr. Fitzgerald just said, your actions today determines our future for tomorrow. So thank you very much. Dr. Haggie.
Thank you very much, Premier. We're seeing the impact on our COVID-19 figures from the events around March 15th to 17th at the funeral home. It's interesting across the country to see that we are following in the footsteps in some respects of other jurisdictions. There have been outbreaks clustered around a retirement home in BC. There was a convention of professionals in Vancouver and a bonspiel in Saskatoon that have all generated similar concerns in those jurisdictions. And St. John's is no different. We are a metropolitan area. It has had an impact on workers in the healthcare system, and because of contacts and the nature of those events at the funeral home, we have somewhere of the order of 60 people at Eastern Health in a variety of skills and occupations who have been affected by this and are currently at home in self-isolation. We have staff across Eastern Health who have tested positive. The total number in Eastern Health is 9, and not all of these are located at the Health Science Centre, however, but most of them are related to the funeral home. These staff are currently well or experiencing mild symptoms, if symptomatic. They are being managed at home and they're being followed by public health. But what it does do is it speaks very much again to the importance of what Dr. Fitzgerald has said around staying home if you do not need to be anywhere else, and particularly for healthcare professionals or workers in the healthcare system. If you have symptoms of any kind like this, don't go to work. Amongst the group of individuals affected in Eastern Health, we have 4 teams of paramedics who are currently in self-isolation. They were unaware when they went to a call of the patient's potential exposure to COVID-19. So if you need an ambulance, please make sure you tell the dispatcher at the time of your call whether or not you've been exposed. The crew will need to use PPE, but rest assured that will not stop an ambulance coming if you need it. Every ambulance in this province, and I must emphasize that every ambulance in this province has a PPE kit. It is important, however, that you repeat whenever possible the fact that you may have been exposed, to allow our first responders to take the appropriate precautions to protect themselves as well as you. The fact that you may have been exposed to COVID-19 or have COVID-19 is not going to determine whether or not you get care. These folk will come no matter what, but please warn them, please let them know. It's for your protection and it's for their protection when they go home to their families. We've heard concerns lately around home support workers. They are concerned about whether they are considered essential workers. The phrase I use, essential workers, is in terms of whether you're necessary to the functioning of the healthcare system. And the short answer is you are. We cannot manage without you. We have extensive information for home support workers, for clients of home support workers, and for home support agencies on our COVID website. And I would encourage you to go and have a look at it. It's in the resources section, and it's at least 3 or 4 pages long. We've supplied this to agencies, and we've supplied it to the RHAs as well, but it is a wealth of information for you. We would encourage for you to use the website. This information is updated regularly, and it should answer the bulk of your questions. Now, yesterday, during some questions, I I've heard that my comments around pharmacists and prescriptions have caused some agitation. And I just want to give a little bit of background to that. We have had correspondence from manufacturers who have been telling the department that they have no issues with their processes. I have had very mixed messages, however, from wholesalers who have given me totally conflicting messages. Up until yesterday, I was not actually aware of any significant shortages related to the pandemic. We have unfortunately become grown accustomed to drug shortages for other reasons. So when I was questioned, I provided the information I had at the time. But on further investigation in the light of comments, the best way I can describe the situation currently is at best it's confusing. The limit on dispensing numbers and periods was set by the pharmacy board in this province. We want people to stay in their homes. We want them to interact as little as possible and to have as little need as possible to go out for essential things like medications. And we won't want people getting out of their homes more often than necessary to get their medications. So the short answer is, at the moment, we're working through these apparent conflicts with the parties concerned. The recommendation of the pharmacy board is, however, a blanket directive. And my information is that the difficulties with supply relate to a very confined group of medications. So that, again, is an issue to work through. But I would encourage anybody who has a question about their medication and supply to speak to their pharmacists. People should listen to their pharmacists. And quite frankly, if what I said yesterday bugged you as a pharmacist, please accept my apologies. That was not my intention. You are crucial to the healthcare system. And as we saw during the snow event, it was really important for the people of St. John's to have access. And it's no different now during the COVID issue. So thank you for the work you do. And I'm just going to close by, again, I will take any opportunity to thank our workers in the healthcare system, whether you lay hands on a patient or you lay hands on the food that they eat, or whether you clean the floors in a hospital. We cannot do without you. You have worked so hard and continue to do that under challenging circumstances when everybody else really wants to be home with their family. I'm really proud of what you do. We have the best healthcare in Canada in this province, and I would argue that Canadian healthcare is showing itself now as the best in the world. But remember, we get through this together. The time to do something about this is now. Stay home if you don't need to be out, and stay home if you're sick. So thank you.
For the benefit of our speakers, we have 11 reporters registered today. In the essence of time, each reporter will be given the opportunity to ask 2 questions and 1 follow-up. We will run through the telephone queue, so each reporter is given an opportunity. Following this, should time permit, I will ask if there are any further questions. This call will end at 3:29 p.m., and reporters can email me their further questions. Thank you. Operator, you may proceed.
Thank you. We'll now take questions from the telephone lines. If you have a question and you're using a speakerphone, please lift your hands up before making your selection. If you have a question, please press star 1 on your telephone keypad. If at any time you wish to cancel your question, please press the pound sign. Please press star 1 at this time if you have a question. There will be a brief pause while the participants register for questions, and thank you for your patience. We have the first question from Peter Cohen from CBC. Please go ahead. Your line is open.
Looking on a per capita basis, this province is now one of the highest. I haven't done the most recent math, but it looks like we're kind of around 2nd or 3rd highest. What do you say to people who are concerned that we're not flattening the curve?
I think it's difficult on the basis of the numbers at the moment to draw any hard conclusions. There's certainly absolutely no room for complacency. We have pulled every lever that the other provinces have pulled, and in actual fact, a lot of them, we have led the way. We have the most progressive set of orders under our health state of emergency. We have acted as promptly as we could, and we were the first of the provinces to actually require self-isolation for those who have travelled outside. the bulk of our cases are driven from one location over a 3-day period. And I think as those cases work their way through the system, the real telltale will be how seriously the people who went there take their self-isolation and the figures that come up from other regional health authorities. If you look, the numbers in the other health authorities are small and are not particularly growing at any great rate.
When you look at childcare, you're providing it for essential government workers. Why not for essential private employees, things like grocery store workers who tend to make a much lower wage to begin with and are still vital to keeping the province going?
Yes, Peter, this is something that we will be looking at. First and foremost, in the early days, we wanted to get an answer for our healthcare workers and some of our correctional officers, police enforcers, and so on. So it was important that we get the message to those who are working front lines. But this is not about forgetting others as well. Like you just mentioned, the grocery store workers and even some people, as as Minister Haggie just mentioned, people that are working in pharmacies supplying, some vital services, to our community as well. So, we wanted to get the healthcare workers and that piece done first, and some others that we identified yesterday. But that doesn't mean that we will not include others as we move through this. We fully are aware of the work that they do in providing those services, and we want to support them as well.
You've said that child care providers should be shut down because of social distancing. We want to keep kids at home. We're hearing from early childhood educators that are concerned because as part of the condition to receiving financial compensation from government, they are required to take children from essential workers. What do you say to early childhood educators who are concerned about their own safety and the safety of the children they're looking after, considering they'll be put into environments that originally we had said shouldn't be happening?
Yeah, so when you look at the regulated childcare operators within our province, as a government, we have continued to support them, continued to make payments with their operating grants, as an example, continue to pay them as if their spaces were full. So all we're asking now as part of this province working together to support those essential workers and others in the future is that they take on a reduced capacity children up to age 13 to support our workers. So this is not about just cutting back. They're paid already, so they're paid to be full capacity, paid their operating grants. So now all we're asking is for those childcare operators to support our workforce that are out there providing essential and services for those in time of need.
Thank you. Our next question is from Kellyanne Roberts from MTV News. Please go ahead. Your line is open.
Dr. Fitzgerald, we've limited social gatherings to 10 people, down from 50. How can we say it's safe for fishing vessels, food processing operators, and plant workers to still operate?
So we have to look at the balance. We need essential services. We need a food supply chain. So we have to balance that. So we've recommended appropriate physical distancing within those plants, appropriate hand hygiene to ensure that workers can stay safe. Obviously, if anyone is sick, they're not allowed to come to work. But we have to find that balance of being able to provide essential services and maintain the food supply.
In terms of the cases that were now today of 15, how many of those are contacts, how many travel, how many under investigation?
Breakdown of today's numbers, travel, contacts, and under investigation.
So I don't have the full breakdown of the 15 that have come in today. Public Health is still doing those investigations as we speak, but hopefully tomorrow I'll have a little bit more information about that.
Thank you. There are rumors running around, and I will emphasize rumors, that some of those that have tested positive did work at a long-term care home. Can you speak to this, and so if those families have been contacted?
I cannot speak to that at this time. I have not heard that.
Thank you. Our next question is from Peter Jackson from The Telegram. Please go ahead.
Hi. I have a question about the travel restrictions now placed in Canada. If a person arriving in Canada is required to self-isolate, in their place of where they land, and then they come here. Are they looking at another 14 days of isolation?
Yeah, so Peter, I want to clarify that because, some of the information that would have been coming out yesterday in the early days of this announcement or the early hours of this announcement, we were led to believe that if you landed at one of the 4 international designated airports in Canada, well, then you would immediately have to self-isolate in those cities. That would be Vancouver, it would be Calgary, in Toronto, or in Montreal. So right now, where we are is that if you're not showing symptoms, when you land in one of those airports, you can continue your travels to your final destination. So let's make this about Newfoundland and Labrador right now. If you come on to Newfoundland and Labrador asymptomatic, the guidelines when you land in Newfoundland and Labrador, either at St. John's Airport, Goose Bay, or for a small number of people that could be coming into Wildbush, you must immediately self-isolate for 14 days.
Oh, okay, so as one follow-up, I'll take that as a yes, that it's conceivable someone with symptoms who might have to stay on the mainland would also have to self-isolate here, so they could be facing
Yes.
a total of 28 days.
That's correct. That's correct. So you could, if you're showing symptoms, you would isolate in the community, in the city where you landed.
Okay, we've talked about a lot of different sorts of work, and one that hasn't come up is sex workers, who are obviously hit hard by this crisis. Are there any? Do any of the supports that are in place would apply to them? Can they avail of any support?
So it was about sex workers and support for them.
Yeah. The challenge that we have with that is similar to the challenge that we faced when we were talking earlier in later last year around the issue around massage parlors in St. John's. The bottom line is that these individuals are in a unique position in that the services they offer are not of themselves illegal, but their clients and the advertising and the rest of it is. It is not a recognized industry, nor does it lend itself to easy identification of people who would want to avail of financial supports. I'm open to discussions with SHOP or places like that, Blue Door, who may be able to advise me differently, but as yet I have not heard from them during this particular pandemic.
Thank you. Our next question is from Elizabeth Whitman from All Newfoundland Labrador.
Hi there. I had a question regarding the local lab that is now able to do the testing rather than the National Microbiology Lab. So I'm curious, what's our capacity for tests at once, and what is the wait time for those results?
That's a good question, thank you. The ability to confirm a test as positive is a quality assurance issue. The National Microbiological Laboratory required 50 tests to be determined and compared. Once those have been done, we are in the position where our test is validated and we know it works. So we've passed that landmark with both negatives and unfortunately positives. In terms of the wait time for the test, once the specimen is received in the laboratory, they are done in 2 runs in the day, and the average gap between each run is about 6 hours. The main determinant of the turnaround, in actual fact, is how long it takes the specimen to get to the laboratory, given our rather dispersed geography. But there is a system in place to do that. The lab is staffed 24/7, and there is capacity yet to do further tests than the number that we're receiving.
Great. And my understanding before was that the Newfoundland and Labrador lab would do the presumptive test, and then it would be sent to Winnipeg. Is now it just being one streamlined test here?
No, what happens is there's 2 parallel streams here. One is for diagnostic purposes, and what happens is the test here has to be validated. We required at least 50 in each category to be identical to the Winnipeg results before Winnipeg would say our test is valid and passes a quality assurance process. Nationally, we have agreed that every specimen would also be sent to Winnipeg because for cataloging purposes and for research purposes, these are gene sequenced. There has been talk that there may be more than one strain of COVID-19, and this is the kind of work that Winnipeg is equipped to do and nowhere else effectively. So the validation piece is simply a laboratory quality control, which happens with any new test, and this was new to us when we started.
Oh, okay. And I was also hoping to get a breakdown between the presumptive and the positive cases now in the province.
There are none. All our tests are either positive or negative, and the results are confirmed when they're issued.
Perfect.
Thank you. Our next question is from Drew Brown from the Independent. Please go ahead.
Hi. I'd just like to thank Dr. Haggie for addressing some of the pharmacy comments in the preamble, because I've also been hearing some of the same things. And I'm reassured to hear that the problem, the manufacturing side of the supply chain is apparently fine. But one of the issues that I have had brought up to me is that wholesalers themselves were not under the impression that they had to report to the provincial government whether there were any issues in the supply. So I'm just wondering if you can clarify what steps the province is taking to coordinate the distribution of the medical supplies in question.
The province has a responsibility directly for the Regional Health Authority drug supply, and that is a kind of separate mechanism, although it's related obviously to the private pharmacies. The facts of the case are that we have had drug shortages on and off for some time due to things that we really cannot explain, because they seem to be manufacturing as much as anything else. But quite frankly, the whole process is opaque and is very difficult to unravel, even for insiders. The challenge that the pharmacist described to me over the course of the last 24 hours is a difficulty, particularly around inhalers for patients with respiratory complaints. That seems to be the focus of the current issue. The manufacturers, particularly the generic manufacturers, have reached out to me directly and tell me they have no issues. And as I say, I've received mixed messages from the kind of middlemen, the supply chain. So we're trying to unravel that at the moment. The pharmacy board is another layer of complexity because they control the standards of practice of all pharmacies and pharmacists in the province, and it was they who issued the requirement for 30-day dispensing and no longer. So I think it's a question of trying to get a common understanding. It's easy enough to do with the pharmacy association here, the pharmacists rather, and the pharmacy board. The challenge is figuring out what's happening with the supply chain outside the province, and we're currently working on that. As recently as this morning, I had discussions with our Director of Pharmaceutical Services, and she is working very hard to try and get some clarity around that.
So I guess what we're trying to find out here, to just summarize it, is this something that's unique to Newfoundland and Labrador, and having some considerable experience as a pharmacist? We've seen drug shortages over the years before. So what we need to find out is if this is something that's actually unique to Newfoundland and Labrador or something that we're seeing in other provinces. What I'm hearing from other provinces is that it is not unique to us, that other provinces are having to deal with this as well. So the way it works, as the Minister just mentioned, is you have your manufacturer who then goes to an wholesaler, or someone does a distribution to your local pharmacy. So somewhere in the middle of this supply chain, there's some problems. We recognize this, but I want to reiterate that the pharmacists are doing, I've spent quite a number of years at this, they are an important role in actually working through COVID-19. We must make sure if there's anything that we can do to improve the supply chain, well, we will do it.
Perfect. Thank you. Thank you very much for those answers. So the second question I had was, we know that federal aid is forthcoming for workers who either forced out of work or have to take time off for COVID-related reasons. And I know that the province has brought in some amendments today, but all that sort of centers on unpaid leave. So I'm wondering if the province is considering any wage subsidies or other paid protections for essential workers like gas clerks or grocery store workers who do need to stay home while sick as part of the public health emergency, but can't afford to miss a shift or wait however many weeks for the federal EI or emergency relief.
Yeah, so what I understand, the The programs that were announced yesterday are very broad, and they would include people, just not those on EI. They would use the EI system and the mechanisms that they would have in place to support people that have been impacted and job losses. We are seeing unprecedented unemployment numbers in this country. As has been said and been reported, we're looking back at numbers that would be similar to what would have been seen in the 30s, and the highest numbers of unemployment rates since they've been tracking those numbers. So the number of programs, and we've been working with the federal government. We'll have another call again later this afternoon to try and figure out how the dynamics are within those programs. But as my understanding, there will be a suite of programs that will be available to those that do not qualify for EI but have been losing income as a result of COVID-19.
Perfect. And it's just a quick follow-up. I don't know, between Snowmageddon and COVID, given how many of these sort of essential workers that we need to keep things running also happen to be minimum wage workers, I don't know if the province is considering revisiting its decision on minimum wage to maybe increase it, given how significant these workers.
Yeah, so right now there are a number of programs that we have available within the province to support people in difficult situations. You're right. This has been a tough start to 2020, and I said in an interview that I did yesterday, if we could have a mulligan to start 2020 all over, well, indeed, I think most Newfoundlanders and Labradorians, would take advantage of that. There is no question. I said this federally many times. This province is in a unique situation compared to other provinces of the challenges that we're dealing with in the start of this year. So we'll continue to work with those that are, especially our low-income earners that are impacted through the hardship that we've had this year. There are a number of provincial programs that are already available, but we'll continue to work with those. If there's more needs to be done, we'll explore what opportunities that we have available to us, but continue to work with the federal government to press for those programs to reflect the relevant needs of low-income earners and wage earners in general in Newfoundland and Labrador.
I asked reporters if they could shorten their preamble. I know we have about 15 minutes left, and there are about 5 reporters left to ask questions. Thank you.
Thank you. Our next question is from Marie-Isabelle Rochon from Radio Canada. Please go ahead.
Yes, so we've seen over the week announcements from provinces to directly help business owners. So Nova Scotia announced $161 million to help business owner. New Brunswick announced that business owner can borrow up to $200,000 without interest rate. Wondering what the province is currently doing to help business, concretely, and does the province has its hands tied because of the current fiscal situation right now?
What was the last part of your question there? Does the province have what?
Their hands tied because of the current fiscal situation of the province.
There's no question, and we've had a lot of discussions with my provincial colleagues and with the Prime Minister and the Deputy Prime Minister in recent days, is that not every single province can be treated alike. Not every single province has a similar financial capacity to respond in this situation. They've heard that, from me directly. They've heard it from our Minister of Finance and our other cabinet ministers that are communicating on a regular basis with the federal government. My colleagues and other premiers in other provinces, they recognize that. We were off to a difficult start, I've just said, so something unique must be done for Newfoundland and Labrador. But we will continue to find ways. I've just mentioned today about a $200 million contingency fund as a result of revenues that will be lost in our province related to COVID-19. Also recognizing that more will need to be done, support for our community organizations. Just yesterday, changes that we're seeing today to support those that rent in our province right now. So we are looking at a number of options, realizing that in some cases it's much more difficult here, but the federal government also recognizes that we are in a unique situation here in our province.
Could you give more detail about this contingency fund? What does it mean for citizens of the province?
Well, what it means is that we're going to continue to work with business. We're going to continue to work with our community organizations to provide supports where we can. It could be through Newfoundland and Labrador Housing. It could be through our working with small businesses directly through our various departments. We will continue to explore whatever ways that we can to support Newfoundlanders and Labradorians who are impacted. That could be small businesses. It could be independent business owners as well. But it's important that we work with the federal government as well, recognizing that we are in a unique situation compared to other provinces.
My last question. So Post Canada closed its center because when they learned there was a person with COVID-19. What is the plan if for a similar situation in a hospital or health clinic? What are the procedures, and will health care workers receive their full wage during their time in isolation?
From the point of view of the healthcare system, we worked hard to create some capacity. Our bed occupancy continues to drop slowly, and we're approaching the 50% mark in acute care. So we have staff, we have beds. In the event that people are affected by isolation requirements or illness, such as the issues around Eastern Health and the Health Science Centre, those people are covered under the terms of the collective agreement with sick leave entitlement and pay benefits. And in addition to that, there is also now the potential that they may get extra through the measures that the Premier has described. That needs to be clarified in time. But certainly their jobs are protected. It's a unionised environment, and we have very robust collective bargaining agreements with a variety of unions, and we've been speaking with them on a regular basis.
Thank you. Our next question is from Julian McKenzie from the Canadian Press.
Hello. My question that I have, I was wondering if public health officials feel that public transit services should be restricted to essential workers, particularly retail and health workers going forward, as transit unions are advocating. The union says without this measure, it doubts the community spread of COVID-19 will actually slow. So I was just curious if you feel that public transit services should be restricted.
Certainly, public transit services have put measures in place to reduce risk. Right now, it's my understanding they're limiting passengers on a bus to 9 and the driver, so that would be 10 in total. And they have physical distancing measures in place. So that is, public transit is an essential service. It's, for some people, it's the only way that they can get around. So we do have to maintain people's ability to be able to get to where they need to go.
I think it's a reminder too that just earlier today we announced changes in the Provincial Ferry system, which is public transit for many people as they go to their homes. Also, the changes that we made and the limitations around the number of people that would be in cabs, as an example, and also discussions that are ongoing with our bus service, the provincial bus service within DRL. So we're consultations and discussions with those that provide transportation for people that need to access services right across our province.
And for my second question, forgive me if this has already been addressed, but can you tell me how many of these new cases are associated with the St. John's Funeral Home that's been linked to an outbreak?
Those investigations are ongoing as we speak, so I don't have that breakdown at the moment.
Okay, thank you.
Thank you. Our next question is from Tyler Dune from VOCM News.
Hi, thank you. How did the healthcare workers get exposed, and what does this mean for patients?
From my understanding of the information from public health, the healthcare workers were exposed at this funeral event over the course of the period March 15th to 17th. No patients we are aware of have contracted the disease from that. Some were sent home to self-isolate because their condition permitted discharge. There were a small number whose medical or surgical condition would not allow them to go home. They have been placed in isolation on other units in the facility. But I must emphasize we have no individuals hospitalized across the province due to COVID-19.
Thank you. And is there a concern about the availability of paramedic services with 4 teams of them now in isolation?
Currently, the paramedic service in St. John's has not advised me of any concerns at the moment. It's obviously something we keep an eye on, and it's a topic that we address frequently to make sure, just like other healthcare providers and other sectors, that we're not running into quiet problems with one particular area, be it paramedics or nurses or janitorial staff even.
Thank you. And lastly, what are the current estimates on how long this public health emergency might go on for?
We have, we're hoping for the best and planning for the worst. I would suspect, quite honestly, that we would not be back to normal by May 24th weekend. I am pretty sure that it's going to be sometime in June. Whether or not we make a Canada Day celebration, time will tell.
Thank you so much.
Thank you. Our next question is from Ross Lord from Global National TV.
Premier, I wanted to ask you, by way of context, how urgent this $2 billion in borrowing is, because we've heard signals and sort of hints and clues in the recent past about how difficult it is for the province to meet its financial obligations. Can you cover payroll without that loan?
We can. There's no question the province is in a very difficult situation, but we'll be covering payroll. We'll be providing for essential services within Newfoundland and Labrador. So that's not the issue. The issue is one of a more long-term situation that not just Newfoundland and Labrador is finding itself in. It's other provinces are there as well. And this discussion comes up quite often with our federal finance minister and our other provinces. The whole country, we're seeing the economy that is broken, it's shaken. But when you see provinces like Newfoundland and Labrador with such a reliance on natural resources, oil and mining, and seeing the impact of what's happening on those industries, this is going to take some time for this economy to be rebuilt. So it's important for us right now to put measures like we're doing in the House of Assembly as we speak to make sure we have the borrowing capacity, $2 billion in this particular case, that will be, by the way, supported by the recent decisions that have been made by the federal government with the support of the Bank of Canada to help support this line of credit or this credit facility to some 40% and more if it's required.
Okay, you saved me a question when you referred to the Bank of Canada, because I was interested in the connection between that move and your borrowing bill today. So that helps. My other question is, you keep referring to talks with the federal government. What is it that the federal government needs to do for your province, and what might your residents expect them to do, whether that's an oil and gas package or something beyond?
Yeah. So we'll continue to work with them on a number of different initiatives. Let's keep in mind from a national perspective, when you look at Newfoundland and Labrador, this is not a province that receives equalization. If you compare this to provinces around the country, as an example, Nova Scotia would be over $2 billion a year in equalization. New Brunswick would be $2 billion. PEI would receive, several hundred millions. Manitoba, Quebec, we all know the numbers, but what we are not getting in Newfoundland and Labrador is access to that equalization program. So we've been pressing the federal government to put in place a program that will support provinces like Newfoundland and Labrador, like the Fiscal Stabilization Program that many of you have heard me speak about, something that could reflect the problems that we are expecting or we are experiencing in Newfoundland and Labrador. So these are the kinds of discussions that we're having with the federal government.
Thank you.
Thank you. Our next question would be from Peter Cohen, if he's allowed to ask a second question.
Peter Cohen has had his opportunity. I'm just wondering right now if we have Holly Mackenzie-Sutter on the line, Paul Willamette, or Terry Boland.
We do not.
Okay, if Peter has a further question, we'll take it. We just have 1 minute.
Hey, question for you. A lot of workers are still obligated to go to work, things like industries that are still open. What do you say to people who feel unsafe still showing up to large workplaces?
So the important thing is the Chief Medical Officer and all of us at this table, we have put in guidelines of what a safe workplace would look like. Social distancing, physical distancing, as it's been referred to quite often, making sure there's proper hand washing facilities available and so on. So these are the regulations, the new rules, the new guidelines that are being put in place. If people are unsafe, they can report this to occupational health and safety, and we're sending inspectors to a number of sites. The important thing is that when employees go to work, it is a safe workplace, and we expect that employers are working with our inspectors and working with the employees to make sure that those workplaces are safe. There are some services out there that must continue to support the support the essential workplace, healthcare, so on. That is a requirement right now. So it's important for those workplaces to be safe.
Thank you. The time for questions has ended.
Thank you very much. Your conference has now ended.